Unit 2 Case Connection Video Presentation by Ariel Siler. Hello, my name is Ariel Siler. I have a Bachelor's of Science in Biology from the University of South Florida. I've been accepted into FSU College of Medicine PA program, class of 2021, and I'm currently taking this biochemistry course over the summer before I go to PA school. I will begin by going over what cases I have chosen for Unit 2's Case Connection Video Presentation, and then I will go on to discuss my responses. For Unit 2, I have chosen to answer cases 3 and 4. Case 3 starts with a situation. A 5-year-old boy is brought to the pediatrician's office for an annual visit. The mother reports he's been a sickly infant and often appears drowsy. She also has concern over her son's persistent thirst and frequent urination. Blood samples are taken for insulin measurements at times 0 and 1 hour after a glucose loading test. The results of this testing are illustrated in the table below. 3 questions are then asked. 1. What is this information likely to suggest about the underlying biochemical basis for the patient's symptoms? 2. What would you predict the patient's fasted blood glucose levels to be given his current condition? Example, above normal range, within the normal range, below the normal range. And 3. List 2 regulatory enzymes that are likely to be active in this individual's current condition. Let's begin with the key information that was given to us in the excerpt about the boy. 1. The boy is 5 years old, so he's a child. 2. The mother states he was often sick as an infant. 3. She also states he appears drowsy often. 4. He is always thirsty. 5. He urinates a lot. 6. His blood glucose levels are taken and recorded. 7. His baseline blood sample is 0.8, which is a lot less than the normal value of 6 plus or minus 2. And lastly, 1 hour after glucose load, he has a serum insulin level of 5, which is very low compared to the normal value of 40 plus or minus 11. These key facts would lead us to believe that the child is diabetic. More specifically, that the child has insulin-dependent diabetes mellitus. This can also be referred to as juvenile diabetes or type 1 diabetes. So to answer question 1, what is the information likely to suggest about the underlying biochemical basis for the patient's symptoms? I would say because the level of serum insulin is continuously low, it would mean that the glucose in the boy's blood is not getting used. This would cause him to become thirsty, i.e. the increased thirst, and due to more water intake, he would have more fluid in his body, which would lead to an increased urination. Now to answer question 2. What would you predict the patient's fasted blood glucose levels to be given his current condition? Example, above normal range, within the normal range, or below the normal range. I would have to say that the patient's fasted glucose levels would be on a higher range or above the normal range because the cells are not able to obtain the blood glucose, and therefore the glucose is going unused in the blood. Finally, to answer question 3, list 2 regulatory enzymes that are likely to be active in this individual's current condition. I would go with phosphofructokinase and pyruvate kinase because the phosphofructokinase is one of the most important regulatory enzymes in glycolysis, and pyruvate kinase catalyzes the last step of glycolysis. Glycolysis is a pathway of glucose metabolism, and through metabolic and regulatory enzymes, it can regulate metabolic functions and insulin secretion. Now on to case 4. The situation presented is, a previously healthy 2-month-old female presents with jittery spells several hours after breastfeeding. Her mother reports she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reports these symptoms started. Laboratory results are consistent with hypoglycemia or low blood glucose, but are otherwise unremarkable. Epinephrine is administered and there is no increase in blood glucose, but there is an increase in blood lactate. Hint, think of what pathways would be activated by this hormone. Physical exam reveals a liver edge 4 centimeters below the right costal margin. Percussion of the right chest and abdomen confirms to megaly, which is an enlarged liver. Blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range during fasting. The question is then asked, based on the information above, which of the following is most likely the diagnosis of this patient? A, hereditary fructose intolerance, B, galactosemia, C, glycogen storage disease, an inability to use glycogen, or D, glucose 6-phosphate dehydrogenase deficiency. Let's begin with gathering the key information. The symptoms are: 1. Baby has jittery spells several hours after breastfeeding. 2. Baby has only had breast milk. 3. Baby has only recently been sleeping for more than 2 hours between feedings. 4. Baby has an enlarged liver. 5. Baby has low blood sugar levels. No effect from administration of epinephrine. 6. Baby has high lactate level. Was increased with administration of epinephrine. 7. Baby's blood glucose levels increase after breastfeeding but cannot maintain blood glucose levels during fasting. Now, let's review our options and common symptoms that go with them to see if they match the baby's symptoms. Option A is hereditary fructose intolerance. Some common symptoms are nausea and vomiting, which the baby does not have, gas and abdominal pain, the baby does not have this either, chronic fatigue, the baby does not have this symptom, and malabsorption of nutrients, which the baby does not have either. Option B is galactosemia. Some of the common symptoms are nausea and vomiting, which the baby does not have that symptom, and loss of appetite, which the baby does not have that symptom either. Option C is glycogen storage disease, or an inability to use glycogen. Some of the common symptoms are an enlarged liver. The baby does have this symptom. Low blood sugar, which the baby does have, and high levels of lactate. The baby does have that symptom as well. Some other common symptoms are also impaired growth, which the baby does not have, bone thinning, the baby does not have this symptom, and mouth ulcers, which the baby does not have that symptom either. Option D is glucose 6-phosphate dehydrogenase deficiency. Some common symptoms are fatigue, which the baby does not have, dark urine, the baby does not have this either, yellow skin and eyes, which the baby does not have, abdominal pain, and back pain, and the baby has neither of those symptoms. The only option that matches the symptoms is option C, glycogen storage disease, or an inability to use glycogen. The other symptoms seen with this disease may not occur and/or may not be seen until later. This, however, is the disease that the baby is suffering from. And lastly, I have a reference page. Thank you so much for listening.